Good morning, everybody. Welcome to our Parent University workshop, Mental Health and Our Children. My name is Amber Dixon. I'm the coordinator of guidance and counseling. And we have some great information to share with you for today over the next hour. Just so that you know, we will be recording this presentation. So just keep that in mind. Please make sure that your cameras are off and that your microphones are muted. We will, if we have some time, we'll take some questions at the end, but we want to make sure that we get through all of this very valuable information for you today. So I do want to introduce our panel for today. We have, fortunately, several of our school counselors right here in Alvin ISD, sorry. We have Faye Cooper, who is one of our social emotional counselors over here for the East Side. We have Katie Gibbs, who is a school counselor at Manville High School. We have Heather Bimbrook, who is a counselor and lead elementary counselor for Nelson Elementary. We have Ms. Vincentia Wright, who is the lead counselor at Shadow Creek High School. And then we have Lakeisha Williams, who is a school counselor at Manville Junior High. So all of this information will be provided to you after the workshop. And we just want to make sure that you know that you have access to your school counselors right here in Alvin ISD if you have additional questions. So just to let you know a little bit about the presentation for today, we are going to talk about the typical behaviors of teens and what may be some concerning behaviors. And I'm sorry, not just teens, but children as well. We want to look at recognizing signs and symptoms of specific mental health concerns. We want to make sure that we are determining appropriate responses and action to these concerning behaviors. And of course, we want to be able to provide you with some resources for more information and for referral. So when we're talking about typical child or teen behaviors, I know that maybe sometimes you're thinking, okay, is this normal? Or is this something more? Should I be thinking about something different? So just keep in mind that your child is unique. So it's important to ask these questions through the lens of what's typical for your child. So as we go through this presentation, keep in mind that we're speaking in general terms, common or typical behaviors. So remember to think about your child and what's typical for him or her, and are they stepping outside of what's typical for them? So here's some things to consider if you're trying to determine if behavior is something more than normal for your child. And so here's one thing you can think about: is your child experiencing a major grade level transition? So if you have a student who is in fifth grade, are they exhibiting behaviors that may be typical for a junior high school student? Or if we have a junior high student, an eighth grader, are they going to high school? There's going to be more complex and challenging issues going up to that next level. So they may be experiencing these changes that would happen with any child. They're going to have physical and psychological changes. They're going to be changing socially, emotionally. The world around them is going to look very different. And so some of these things that you may be experiencing or behaviors that they're exhibiting could be because of these major transitions. So when we look at, is the behavior within their expected developmental age? These are a couple of things you could be thinking about. So we are going to focus here on the social, emotional, and the psychological traits. So let's throw out elementary students. Okay, I want you to think about, if you have children that are elementary age, so pre-K through fifth grade, think about some of the things that they're doing. Okay, so some common behaviors that may be unwanted could be meltdowns. They may be whining a little more. Maybe they're always saying they want to be like so and so. They want to be like other kids. Or maybe as they're a little older, they may be shying away. They may be wanting more privacy. Maybe they want more physical contact from you when they're under stress. Maybe they're having some major mood swings. So again, just kind of be thinking about your child if they're around this age range. All of those things that I mentioned and more are normal. They're very common. It's very typical. Those are things that, that comes with parenting, that comes with discipline, that comes with working with teachers, as far as working through those issues. Now, if you have a child in the middle school age range, I want you to think about that precious child and what are they going through? Are you noticing them becoming a little more jealous? Maybe they're wanting to keep secrets. Maybe they keep secrets from you. Maybe you notice that they want to be accepted by their peers. They're going to have some mood fluctuations. I know some of you may think, yeah, that talking back one, my middle schooler is starting to do that. And maybe they're highly critical of themselves. Maybe they think they're not smart enough, or their friends are faster, stronger, more social. They may be stressed about their ability when it comes to competition. Again, all of these things are common behaviors for our middle school aged children. High school, our beloved high school teenagers. I want you to picture your kid in mind right now. Are they wanting to only be with their friends and not with you, right? No family. They're only loyal to their friends. Or maybe they want pure privacy all the time. Maybe they want to fit in. Maybe they want to become less dependent on you and more reliant on themselves or getting support from their friends. Maybe they're also talking back. Maybe they're acting indifferent, like they don't care about what's going on around them. So, again, these are all some common behaviors from our different age ranges. And I just wanted to make sure that you could have some of these ideas in your head and begin to determine what is common and typical, and then what might be something more. And so we have our panel who is going to help provide this information about what might be more. So what we've done is we have taken some questions that you, our current audience, that you have put in as questions concerning mental health with your children. And so what we want to do is provide some information based around those questions. So our first presenter is going to be Ms. Gibbs. And our question is, what is depression and what do I need to know in order to help my child?
Good morning. So the American Psychiatric Association defines depression as a common, serious, but treatable illness that negatively affects how you feel, the way you think, and how you act. And the graph over to the right is from the CDC. These are diagnosed children with depression. 3 to 5 year olds, it's barely over 0. 6 to 11 is about 1%, and 12 to 17 is 6%. Some sources say as high as 8% for actually diagnosed depression. So the universal symptoms for depression for children, teens, and adults are feeling sad or having a depressed mood. And for them to be diagnosed with depression, these emotions last longer than 2 weeks. Loss of interest in or pleasure in activities once enjoyed, changes in appetite, trouble sleeping, sleeping too much, loss of energy, increased fatigue, feeling of worthlessness or guilt, difficulty thinking, concentrating, or making decisions, and then thoughts of death or suicide. Some other ones that could be more related to children, crankiness or anger. Of course, we've all seen that with our teenagers too, but vocal outbursts or crying. And then the children do often have more of the physical complaints like the stomach ache and the headaches. Okay, so as we've all thought, research is now definitely supporting that the pandemic has affected all of our mental health. You can see this graph is from January 2019 to October 2020. And you can see how this is mental health issues that went to the emergency department. And you can see how those increased. Notice that I said mental health issues because you're going to see with our presentation that these are all connected, they're intertwined, they overlap. And so this is just mental health in general. There's definitely been an increase with the pandemic. Okay, one of the emotions that does get mixed in with grief, especially in the pandemic time, because people have lost loved ones, grief is separate than depression. Grief can definitely lead to depression, so you need to keep an eye on that person. But here's three subtle differences between grief and depression. If someone's grieving, the pain usually comes in waves, and it's often mixed with some positivity, some positive memories. Whereas depression, the mood and interest just are decreased, and there's not much positivity. It's just a downward sadness. In grief, the person's self-esteem is not usually affected by the situation. Unlike depression, where they're feeling worthless, they're feeling self-loathing, it's all about them. And then in grief, thoughts of death may surface when they fantasize about maybe joining the loved one. But in depression, the thoughts are again focused on themselves, their worthlessness. They don't deserve to live. They're unable to cope with the pain of depression. So that's one way you can kind of decipher between grief and depression. So no one really knows what causes depression. There are some factors that the experts all agree on. The first one is biochemical. You can have a chemical imbalance in your brain, and that can be common. And heredity is a big one. Yes, if someone in your family has struggled with a mental illness, it does increase your risks of struggling with that mental illness also. But I'd be real careful with that. As a parent, I would be aware of that information, but don't look for it. Don't expect it. Just be aware that that is something that runs in your family. Trauma is a big one. And the key with trauma is something can be traumatic to one person, but not the other. So anything that someone perceives as traumatic is traumatic to them. And so we have to honor those feelings. One example of that would be two children from the same family, and there's a divorce. One child might see that as just something that happens. They're disappointed, but people get divorced and they're okay with it. Whereas the other child could be completely traumatized by that and needs some extra support. And then issues that impact self-esteem, anything that singles a student out, again, it has a lot to do with personality type. If being obese, bothers them, or being too tall or too skinny, if it bothers them, then it can lead to feelings of sadness, which could lead into possible depression. Academic issues, ADHD, these are risk factors that could potentially lead someone to feel depressed. Okay, this is my favorite slide. Okay, so what can parents do? So first of all, they can facilitate a healthy lifestyle. So there's a lot of research on exercise and mental health. Of course, we all know how it helps our physical health, and now more and more research is coming out on the importance of exercising and your mental health. And some studies are confident enough to say that 80% of people who are on antidepressants wouldn't be on them if they regularly exercised. So they still haven't completely proven that across the board, but I think that's something to think about. They say that 45 minutes a day is ideal, but if 15 minutes a day is all you can get, that can be make a difference also. And I listed some things that you could do with your child: walk, jog, ride bikes, jump rope, dance around the house. Exercise videos, those are all free. They're all accessible. Those would all be good for you and your child. Of course, a healthy diet, drink water, eat fruits, vegetables, complex carbohydrates. We all know we're supposed to be doing that. That helps in everything. Regular sleep. Ideally, a teenager, in a perfect world, they would keep their sleeping pattern the same on the weekends as the weekdays, but no one does. But if your child is struggling with some sadness and they're open to that, if you could encourage them to keep the same sleep schedule, they may see some improvement in their mood. Another suggestion is to have your child turn their phone into you at night. If you don't feel comfortable with that, turning all electronic devices, even TVs, off an hour before bed could be like a house rule. Research shows that the screens can stimulate the brain and make it hard to relax, and they could spend that last hour, whatever, reading, writing, drawing, bathing, doing things that are relaxing. Quality time with your child. So the tips for success for quality time with a child is no distractions and maintain eye contact. I know that I learned this with my own son. He was in elementary school and he would follow me around the house for literally hours after school to talk about everything. And I would just keep doing my thing and he would follow me, and it was becoming exhausting and frustrating. And I said something to my mom and she said, "Yes, but you were the same little girl that when I was ironing one day, you told me I wasn't listening to you because I wasn't looking at you." And so I heeded that advice, and I told my son that I would give him 15 minutes. That's not like a magic number, but that's what he got. 15 minutes timed, and I put everything down and I sat with him and I looked at him and I talked to him, and that was all he needed to be fine the rest of the night. So kids know, just like we do, when someone's not really listening. My other favorite thing is learn your child's love language. I put the quiz in my reference sheet. It's a great resource. There's lots of books on the 5 love languages. And I have an example of this. I was working with a parent who was having difficulty bonding with their 6th grade daughter. They'd had some trauma and some history, and she just was having a really hard time. So we did the love language, and it turned out her daughter's love language was touch. Well, that was the absolute lowest love language on the mom. And so she was like, "I don't think I can do that. I'm not touchy. I cringe when people touch me." She said, "I won't remember to touch her." And I said, "Let's do this." I said, "Let's set some reminders in your phone. Your child doesn't need to know. And when the timer goes off, go put your hand on her shoulder. Just do some sort of touch." She did that. She eventually got to where she could sit beside her daughter on the couch. Her child could lay her head on her shoulder, on her lap. And instead of turning into something like she needed more and more touch, it got to where she felt more and more secure and loved. And it really made a difference in the relationship. So I highly recommend that you find out what your child's love language is. Okay. I turned my timer on, so I'm trying to hurry. But so the next one is confront thoughts. So when your child comes home and says something like, "Everyone hates me," don't just say, "No, they don't," or "That's not true." Take a second to dissect that statement. This is one of my favorite things to do, and ask them for facts and say, "Okay, you said everyone hates me. Well, I don't hate you. Well, you're my mom. I know, but your dad doesn't hate you. Well, that's my dad. Okay, but so not everyone hates you. Well, everyone at school hates me. Every kid at school hates you. Well, so Marcia hates me. Okay, so Marcia hates you. And why does Marcia hate you? Well, because she wouldn't talk to me at lunch today. So when Marcia doesn't talk to you at lunch, that means she hates you. Yes. Well, could it mean something else? I don't know. Could it mean that Marcia's tired? Could it mean that Marcia is thinking about something else? So you just kind of take them through that, and then you explain to them that, you can't just throw things out like that if you don't have some facts to back it up, and you don't have facts to back up that everyone hates you. Did Marcia say she hated you? No. Okay. Well, then we're not going to assume that Marcia hates you and she hasn't said it. Journaling is another one. Encourage your child to write their thoughts in a journal. It's an excellent way for them to process those thoughts, but you cannot read their journal. That is not the place that you're going to learn anything insightful. It's so detrimental to your relationship. Those are private thoughts. You're never going to learn anything that's going to benefit you if you read their journal. So if you're not going to not read it, I wouldn't recommend it. Then the next one is write and destroy. Another one of my favorites. I saw one of the questions that parents had. How can I get them to talk to me? They may not talk to you, but they may sit down and write their thoughts on a piece of paper, and you have them write whatever they want. No one's going to read it. No one's going to keep it. And as soon as it's over, then you shred it. And as you're shredding it, you talk about how those negative things are leaving them for positive, or you burn it. That's a little bit more fun. You burn it, the negativity's going in the air. You ask them if they feel better, that hopefully they say yes. And then you have to resist asking them if they want to talk to you about it, because it's over. So that's something you can do. It's not about what was bothering them. It's about that they got through it. Okay, so if your child is suffering for longer than 2 weeks, or things are getting worse, or as Amber said earlier, your child, and if you know things are just not right, take them to the child's physician. They'll probably recommend psychotherapy, which is talk therapy. The most common is CBT, cognitive behavioral therapy. It's wonderful. Can be individual or small group, and they may recommend medication. Those are the steps that the physician will probably follow. And there's my quick references. And if you click on that link when we share it, that it should take you straight to the love language quiz. Okay, I went a little over. Sorry.
No, you're good. Thank you. Thank you, Ms. Gibbs. And yes, we had somebody write in the comments, how do you find out what their love language is? And so this is, Ms. Gibbs has provided that resource right within the slide. So you'll get access to that hopefully by tomorrow. All right. So now we have Ms. Lakeisha Williams, who will be helping us to understand and dissect this next question. So the question is, my child is in elementary. What could he possibly be stressed about with school? How do I know if this is anxiety and how can I help? Oh, I think you're muted, Ms. Williams.
I'm sorry, I was following all the directions until it was time for me to talk. Good morning. I am Miss Williams, like Miss Dixon said, and thanks to everyone for joining us. I know the question said elementary, but I'm going to be honest, I kind of expounded that and just kind of talked about students in general. I am a junior high counselor, so I kind of tend to go that direction, but a lot of this information is for all students. So to get started, you may hear your child say things like, it's just too much. This is making me nervous. I'm worried that I won't do well, mom or dad. Will my friends think I'm stupid? Will everyone laugh at me? So today we're going to talk about stress and anxiety. A lot of what you will hear in this part of the presentation, you'll probably say, well, wait, that's what Miss Gibbs just talked about with depression. So a lot of it, like she said, is intertwined. So we'll get to explore that as well. But we'll talk about the differences between stress and anxiety, what causes stress and anxiety, what's the definition, signs to look for, and how we can help as parents, as school counselors, as teachers, as adults, just that sort of thing. Next slide. All right. According to research.com, 7 out of 10 teens in the U.S., and this is junior high school kids, so between the ages of 13 and 17, have named anxiety or depression as a major problem among their peers in the community. 75%, or 3 out of 4 high school students, express boredom, anger, sadness, fear, or stress while in school. And we have 75% of American high schoolers and 50% of middle schoolers describe themselves as often or always feeling stressed by schoolwork. So the difference, is it stress? Is it anxiety? That is the big question. So when you are stressed, you may not feel like sleeping or eating, or you might sleep or eat too much. Kids might feel cranky. They might have trouble paying attention in school. They might have trouble remembering things at home like chores, or at least they say they do. Parents should be careful not to mistake stress for attention deficit disorder. So stress is a response to a threat. It's what you feel when you're worried or uncomfortable about something. Children might say they have a stomach ache or a headache. They might feel angry, frustrated, scared, or afraid. But then you're like, okay, is this stress or is this anxiety? Anxiety, and we'll see in the next slide, it's more intense. It's more long term. Are these responses to the threat, or the stressors causing us to, is it ongoing? You have feelings of fear. There's some panic. Sometimes there's phobia. You're worried or nervous. It's when our brain tells us something is not right and we need to deal with it, but it's more ongoing. And in the next slide, it's a visual of stress is considered more short term. Anxiety can linger on. And as you can see, a lot of the symptoms overlap. But, I always caution parents, like, they're like, well, my child is always nauseous, so he must be experiencing stress. Yes, maybe so. But, a lot of these symptoms, you'll have more than one symptom. and it lasts for a longer time, or it affects their day-to-day things. My child is always angry, but he's also, he's, feelings of unhappiness or overwhelm, versus anxiety, where you're seeing, sweating and tense and restlessness. He can't sleep at night. And so you start to realize, okay, and then like I said, Miss Gibbs talked about depression. So some of that starts to kind of all overlap together. As you can see in the middle, you have some symptoms that overlap: faster heartbeat, faster breathing, diarrhea or constipation can also cause stress and anxiety. Next slide, please. So as you can see, this is a visual of how to recognize anxiety. Again, kind of talking about like the last slide. You see a lot of these things and you're like, okay, they're now starting to affect my child at school, at home, with friends and family. I'm noticing a big change, and I'm noticing a lot of these, and it's all the time. Then you're like, okay, we have a problem. My child is always, as soon as we talk about a topic, he has a headache, he's sweating, at school, teachers are calling me because, it's affecting his schoolwork or is affecting friends. I'm also a licensed therapist, so I have a client, and right now, we're dealing with a lot of stuff, and he's stressing, he has anxiety at school, and we didn't know it at first, and his behavior has changed drastically. He's literally going to school wanting to fight, and it's like, okay. And then once we talk about it, we realize, okay, there's some depression, there's some anxiety about different things. So it's starting to affect his behavior, not only at school, but at home as well. So when these things linger on and you have multiple symptoms, then that's when it's cause for concern. Next slide, please. All right. So some of the common causes of stress and anxiety, again, a lot of this will be related to what you heard about depression. Frequently moving or changing schools, that can cause a kid stress. My parents are fighting or arguing. We always hear, like, oh my God, the way you send a student to school, be careful what you say to them in the morning. Some students, come and, parents argue the night before. Well, of course, they're stressed about that. They're thinking about that, so they can't concentrate on, the math lesson. Death of a loved one, a lot of kids, especially elementary, they've never dealt with the death of a loved one, a parent, a grandparent, a best friend. So how to navigate through that. Being ill or getting injured in a car accident, again, a life change. So how to deal with that. So that can cause some stress. Something that we as adults might think is simple: school related issues like quizzes and tests. We think, okay, you studied, you got it, but we have kids that have severe test anxiety. Being the victim of bullying can cause some stress and anxiety. Natural disasters such as a hurricane, the pandemic. One thing I found in the research and just kind of knowing, there's such a thing as good stress and bad stress. And so even reading this list, we have some good, or what, researchers say is normal stress. And normal stress could be something as simple as a teacher calling on a student in class. And even though that student might know the answer or might be well prepared, just to speak in front of the group, a elementary, junior high school student might think, oh my God, maybe, like for me, I have a strong Louisiana accent. So for the longest time, even though I like to talk, like I was always a little anxious about, like how am I going to come across, or, I might not, pronounce my words correctly. So students but I had the knowledge. So it's the same thing. Like students might think, is everybody going to laugh at me? So that's some good stress, because you have like the butterflies in your stomach and you kind of get through it, but it's still stressful. So public speaking. So that's kind of the good stress, because you're like, but I got it. I got through it. I want to do this. Like I have the knowledge. I worked hard on this presentation, but I just have, a little bit of jitters. You also have the bad stress. That is what leads to the anxiety. And that's kind of what this list is mostly about, is the bad stress. So next slide. All right. So there are different types of anxiety disorders. The most common ones, separation anxiety. Um, when kids are very afraid when their parents or guardians are away. My sister used to travel for work years ago. My niece was a baby. We didn't, really like put two and two together at the time. And she would travel. She would leave on Sundays and arrive back on Thursdays. Friday, she would sleep all day and spend time with her two kids on Saturday. Well, my niece, has severe separation anxiety. And again, because she was a baby, we just thought, oh, she's crying. But kids do. They, if they don't know when their parents will return, or, just being away from parents. So that could be one thing. Phobia, we've all heard of phobias. We might even have some of our own, but it's having an extreme fear. Some people have a phobia of dogs or cats, insects. I'm afraid of heights. So different types of phobia. That's an example of an anxiety disorder. There's also social anxiety, being very afraid of school and other places. I have a client that has social anxiety. She cannot go to the shopping mall. So we're working on things about, kind of exposing her to just public places. So that's one. And then you just have general anxiety disorder, being very worried about your future and about bad things happening to you. So those are some things, very extreme, going from stress to anxiety, but those are some anxiety disorders that we see that are more common than we think, but they're definitely there. So the pandemic and anxiety. Children and teens deal with a lot of different situations as it is. And so having a worldwide pandemic just kind of was, the icing on the cake that we really didn't ask for, or we don't really need. Some effects of the pandemic that our students have faced: challenges of virtual learning. I think even us as adults, like trying to navigate through Zoom and Google Meets and stuff. So that was big even for me. And I thought I was very tech savvy until I had to do it all the time. Some homework expectations, less access and guidance from teachers. Some students need to be face to face. They need to. I have students that come in here and say, Miss Williams, I just had to be able to like reach out and touch my teacher. Like this virtual learning was not it for me. Requirements that they have to be self-motivated. They have, so that the pandemic did that, where, it changed their way of thinking and their way of learning. Limited face-to-face contact with their peers. They couldn't go out with friends. They couldn't see friends. They couldn't see family members. Not being able to, see grandma and grandpa. I'm from Louisiana, like I said. And so I have a 98-year-old grandmother that I can't see like I would normally want to see. So I have to be careful. I can't go home as often, just to not, bring any, stuff to them that they don't need to have. Dealing with our new normal. So that can cause some anxiety and feeling trapped, like I said, by limited social interactions, not being able to see my family or your friends and stuff like that. So that can cause a lot on top of just the general stress and anxiety that we deal with. 5 tips for stress, and I'm gonna I know I don't have a lot of more time, but things that we can do: check in with your child regularly, identify and reduce the sources of stress. So know what's causing stress. Talk to your kids. Take steps to improve their sleep. At night, kids are on technology. So like Miss Gibbs say, like, have them turn in their phone, get off of the gaming system, like get some sleep. Practice stress management, stretching, meditation, exercise, and build some time in the schedule for self-care, for relaxation, for fun activities. Go outside, take a deep breath, get some fresh air, that sort of stuff. And this is kind of the same thing. Self-help can help treat anxiety. There are some apps. There's the Calm app. I actually use it. And there's also Headspace. Medication can treat anxiety. It's prescribed by either your child's pediatrician or a child psychiatrist. Calming techniques like breathing exercises and talk therapy, cognitive behavioral therapy, also helps to treat anxiety. According to kidshealth.org, I found this to be interesting. It's kind of all what we've been talking about, but you kind of remember it. They use the acronym of SELF. Make sure you keep yourself in mind, and it's sleep, exercise, leisure, and food. So if you get enough rest and get exercise and, eat a balanced, healthy, have, diet, and then find time for fun, for things you enjoy, then that keeps the stress away. So just finding that balance. This is just a visual example. I thought it was kind of cool. I kind of need to put that up in my own office, but just things as a reminder. And this is not only for our students, but ourselves as well. Just, just some little sticky notes of reminders of what we need to do to reduce our stress and anxiety levels. And some helpful resources for your kids. There is a great video. It's on YouTube, and it teaches children about stress, because they might not. Sometimes kids go through things and they don't know like how to identify. They don't know that it's stress, or they don't know how to explain it to us. So this teaches them about stress, how stress is natural and normal, and how, what we can do to help them. There's also a booklet, and it's published by Mental Health Foundation, and it's for parents. It was published in the UK, but it's some great information in there. And so you can download that for free, and it talks about the anxious child. So those are two very helpful resources that I find that I, give to parents and use with kids. So thank you. That's it.
Thank you, Ms. Williams. And just a reminder, this presentation will be shared with all of the parents and family members who registered for this event. So you'll have access to all of these links and information. Okay, so now we have Ms. Faye Cooper. So the question number 3 is, recently my child has experienced so much death around her and also has a terminally ill parent. How can I help if I'm struggling too? So this is a very, it's kind of a specific question, but Mrs. Cooper, if you could just shine a little bit more light on grief.
All right. Thank you, Amber. Good afternoon, everyone. Yeah, so this is definitely a great question that leads into the topic of grief, right? And so grief is such an important topic nowadays, especially nowadays. We already live in a world that's got so much going on. You had a pandemic, and then there's, changes that we have to experience, sickness and just loss all around us, right? And so that just means that we can't help but feel a certain type of way, right? And so we really hope that, with what I present to you today on the area of grief, that you can use it to kind of help guide you to support your kiddos, your family members, and even yourselves through that process, right? So today, what we want to explore is we want to talk about what is grief, the types of losses that cause grief, typical responses associated with grief, grief myths, grief and the pandemic, and then how should you respond? What are some things that you can say and do to help out? And then, of course, some quick references for you to go back and refer to. Okay, so let's talk about what grief is. First of all, let's talk about grief being the normal and natural reaction to significant emotional loss of any kind. I want you to really focus on the key words, emotional loss of any kind. I want you to keep that in mind, because a lot of times we think that, grief is caused by death of a loved one or someone close to you. But in fact, it's caused by so many other different things that we're going to get into in just a little bit. Also, grief is the conflicting feelings caused by the end of or change in a familiar pattern of behavior. Think about some things that you're used to doing on your day-to-day routines, right? Family traditions that you have, just things in general. I'll give you an example. A while ago, before my grandfather passed away, he would be the first one who I would call after work every day. Well, my grandfather passed away, and a week after that, when I went back to work, what was the first thing that I was inclined to do? Call him, and then realized, oh, he's no longer there for me to call, right? So those are some of the conflicting feelings that are caused by grief. Grief is also the loss of hope, dreams, and expectations. Okay, next slide. All right, so remember, I told you that grief is the normal and natural reaction to any emotional loss, right? So there are over 43 types of loss that can be experienced. Grief is caused by so much more than just death. It can be divorce, retirement, moving, pet loss, financial changes, loss of safety, loss of health. Notice how all of these listed here on this slide all have some type of emotional connection, right? And so when we understand where grief comes from and how it looks, that's when we're better able to identify what grief looks like in others and also in ourselves. Okay, next slide. All right, so let's talk about some typical responses associated with grief. Some of you have probably heard of the 5 stages of grief. I'm sure you've heard of it. There's five stages. It's denial, it's anger, it's bargaining, it's depression, and it's acceptance, right? So we've been taught, most of us have been taught, that our emotions and our behaviors fluctuate between that cycle and those stages, right? But guys, grief is not a cycle. It's a complete whirlwind of emotions, right? And we feel it at 100%. Think of a blender where you can kind of turn the dial and put it up and then turn it back down. Her emotions, there's no dial for grief, right? You can't turn the intensity down. It's going to be painful. It's going to be intense, and it's really exhausting. So think about what your kids go through when they're grieving. It's a complete roller coaster of emotions. And so some of the other signs that you can see in your children, they may have reduced concentration. You'll see a change in their grades. Maybe the grades are going to go down significantly, maybe a little bit, but that could be a cause of them grieving, right? A sense of numbness. Maybe they're sleeping more or sleeping less or eating more or eating less. Again, these are just some of the typical responses associated with grief. All right, so this slide talks about some myths associated with grief and why you should avoid using them. I can't tell you how many times I thought I was helping others and used one of these myths, and my intentions were great, but in reality, it wasn't helping the person who was grieving, right? Okay, let's look at the first one. It's don't feel bad. Okay, you want to tell people, don't feel bad. It's okay. It wasn't your fault. It's okay. We're going to get past this. But here's the deal. It's even though it's an intellectually true statement, it's not helpful, right? Because we have to let the griever know that it is okay to feel pain, to be sad, and to have those negative emotions. Because if we don't express that, it's going to have a tough consequence on our body, right? So all feelings serve a purpose, and we want to make sure that they're able to express that. It's okay to feel bad. Okay, number 2, replace the loss. How many times have our kiddos either lost a fish or lost a pet? Oh, it's okay, we'll get you another one. But remember, we're talking about emotional connections. If they had an emotional connection to that pet, you can't just replace it, right? You can't remove the feelings that are attached to whatever was lost. The only thing that's going to help is for us to get through those emotions, is to talk through it, to express ourselves. All right, let's look at number 3, grieve alone. Yes, it is difficult to watch others, grieving, and it's others to watch them in pain, right? But if you encourage them to be alone, what it's communicating to them is that it's not safe to express how they're feeling to other people, right? It's best if you just kind of show them and encourage them to be with others, even if you're there with them in silence. Just sit with them and know that you're like a safe place for them. All right, number 4, be strong. I tell my kiddos this all the time. When they're going through something, you can either be strong or be human. Guys, we're human and we're designed to feel emotions, right? And so I tell them all the time, you acknowledging your true feelings and accepting how you are, that is what being human is. We can't tell other people to be strong. It's okay to express ourselves, right? All right, keep busy. If you decide to take a hobby or to clean out a closet or to organize just to kind of forget about what you're feeling inside, all that's doing is it's just burning completely, just going deeper and deeper inside of you. And you're just hiding that emotion inside of you. You're going to have all type of, you're just going to hold on to all that emotion, right? And if you don't let it out, you won't be able to acknowledge, that emotion in order to be able to heal from that. All right, number 6. Oh, it'll get better with time. Time heals all wounds, right? No, it does not. Okay. Yes, it's okay. It's going to get better after a while. However, it's only going to get better if you are dealing with that emotion and if you are working through it and expressing it and getting the help that you need to get through it. Okay. All right. So think about how you responded to the pandemic and some of the challenges that you experienced, right? So remember when I told you that changes in a familiar pattern can cause grief? Well, look at all the changes our kids experienced. Virtual learning, wearing masks, social distancing, COVID testing, limited interaction with friends, staying inside for longer periods of time, not being able to go many places, right? We still hear people talking about, oh, when are things going to get back to normal, right? And you know what that means? That's only indicating that there's a longing for how things used to be. We miss it, right? There wasn't a person that wasn't affected by this pandemic. And many of us are grieving the fact that we may never get back to normal. Next slide. All right, so what are some of the things that you can do? First thing is to stay present. There's no perfect thing that you can say to someone who's grieving, right? Just actively listen to them. Just be in the moment with them, right? It's communicating to them that you're a safe person to be around, that you're a safe person where they can express themselves, right? Being empathetic, you're human too. So it's okay to cry. It's okay for other people to see you cry. It sends the signal, it communicates to them that it's okay to share those sad emotions with each other, right? Ask them, do you want to talk about it, right? Make sure you listen to what they're saying. A lot of people don't like this question because it can get a little bit awkward, right? Like you don't know what to say back, you don't know how to react, but giving that person just a safe place to talk about what happened and normalize their experience, that's what they need at that moment. All right, so some of the things that you can say to help, let them know, you know what, that relationship that they had with that person or with that object or with that place, because remember, it's any type of emotional loss, not just death, right? That they had a unique relationship with that, right? So tell them, oh, I can't imagine how painful that must be for you. I can't imagine how hard that must be for you, right? That statement validates how they're feeling emotionally, but it's also respecting that unique relationship that they had with whatever they are grieving, right? Let them know, I can't imagine how you feel. I know when I lost my grandfather, I felt horrible, right? That communicates to them that you're a person that they can safely express their feelings to, while also respecting, again, that unique relationship that they had, right? Don't forget to listen with your heart, not your head, because here's the deal. Your heart isn't, it's your heart that's broken. It's not your head, right? Intellectual statements like don't feel bad, they help the brain process what's going on, right? But they don't help the heart heal, right? So have them express to you what they're feeling, their emotions, without any type of judgment. Okay. All right. So what to do if you're struggling with grief as well? Guys, it's okay to say that you don't have the capacity to be there for someone else. Learn your limitations physically and emotionally, and don't overextend yourself, right? Set boundaries and be gentle with yourself. Find a support group that can help you so that you don't have to do that alone either, right? You have to find your village. Don't be afraid to ask for help when you need it. And remember that it's okay to just sit in silence or just cry with someone else. It's okay to share those type of emotions with each other. All right, so here are some resources. When you guys have this presentation, you can click on the links. This book, When Children Grieve, it's a really good book. It'll give you tips, strategies, resources on how to help children deal with grief, right? And you can use those same strategies on adults. They're not just for children. It's a great read. Also, there's a counseling resource list. There you can have a whole list of counselors, outside counselors, therapists, psychiatrists, psychologists in the area, in case you need any additional support outside of just a school setting or outside of if you want to go to family counseling to all help with the grief together. There's a whole list of places in the area. All right, so quick reference. Remember, just kind of like a short little summary, avoid the myths. I know you're trying to help, but we have to make sure that we're very conscious about what we're saying to those who are grieving, right? Listen with your heart, be present, be empathetic, be gentle with yourself, and remember that emotional loss of any kind can cause grief.
Thank you, Ms. Cooper.
Mm-hmm.
So we are going to continue, and just a little forewarning, we are probably going to go over time. So we completely understand if you have to log off, but remember this is being recorded. So Anna, we hope it's okay, but we want to make sure that we're giving you all of this great information, and we are talking about it pretty quickly. But again, we hope to see more workshops in the future, and we can expound on some of these things individually. But definitely feel free to hang out with us as we continue on. So question number 4, Ms. Vinchinsky of Wright is going to help us with this. My child won't open up or talk to me. I'm afraid that he is harming himself in some way. How can I know what's going on if he won't talk or he just says, I'm fine?
Thank you, and good afternoon, everyone, again. And so, yes, this is a question that's always on our minds as parents. How do we get our kids to talk to us? How do we get them to open up? Or how do we even know if something is really going on? So many adolescents who self-injure, they do so in secrecy. Although it's normal for adolescents to want to pull away from parents and tend to gravitate more towards friends, it's not normal when they do so physically and emotionally for long periods of time. So this is going to bring us to our next 2 topics, which are self-harm and suicidal ideation. So self-harm is also known as non-suicidal self-injury. The definition of it is the deliberate self-inflicted destruction of body tissue. So meaning, but it is without suicidal intent. So examples would be cutting yourself with a razor or sharp knife and in places that you would never see, causing burns, pulling out hair, picking at wounds to prevent them from healing, and in extreme cases, even breaking bones. So self-harm is considered a sign of emotional distress. Again, it is not the same thing as attempting suicide. However, it is a symptom of the emotional pain that these adolescents or people are trying to take away very quickly, that they're unable to deal with or cope with at this time. So the next slide is why self-harm. So again, as I stated before, self-harm is a sign of emotional distress. As adolescents are growing and developing, they're experiencing some emotions, some for the first time, and others from a new perspective as they're gaining and learning on the experiences as they grow up. So when they are unable to cope with the emotional distress, some adolescents may begin to self-harm. So they may start with an overwhelming anger, frustration, or pain that they're unable to deal with. And when they're not able to deal with these emotions, self-harm may feel like a release. Sometimes injuring yourself stimulates the body's endorphins or pain-killing hormones, and that raises their mood when they actually self-harm. And if a person's not feeling any emotions at all, just kind of emotionally numb, they may try to self-harm so that they can feel something real. So here's some statistics about self-harm. About 17% of all people will self-harm during their lifetime. The average start of an adolescent beginning to self-harm is 13. 45% of people who do self-harm use the method of cutting as their main method of self-injury. And about 50% of people who seek help for self-harm, they seek help, but from friends and not from actual professionals. So that's something that we definitely want to focus on and try to change. So here's some warning signs that someone may be injuring themselves. Again, as I stated before, those unexplained cuts, burns, bite marks, bruises, or bald patches from pulling out hair, keeping themselves covered. We live in Texas, and in the summertime, it is hot. But if your student is adamant about wearing long sleeves, hoodies, pants, even with extreme weather, that could be a warning sign that they're trying to hide some of those marks. Bloody tissue and waistbands just out of nowhere, seeming low or depressed, kind of going back to some of the things the other ladies said before, blaming themselves for problems or expressing feelings of failure, or having certain outbursts of anger or being argumentative, not as normal as, as teens or adolescents, they do that on the norm anyways, but just out of the ordinary types of outbursts of anger could be signs, warning signs that your student may be self-harming. So just to coincide with what the other ladies stated as well, the pandemic has definitely had an effect on adolescent mental health. So Fair Health analyzed data from over 32 billion private healthcare claims records, beginning from January to November of 2020. So right at the beginning of the pandemic. And they noticed that there were significant spikes when it came to mental health issues for those adolescents who are in the age group from 13 to 18. There was over a 90.91% increase in those students who were admitted to emergency rooms for self-harming. So some consequences of self-harm. So adolescents who do, they can have feelings of shame. This is not something that they want to do, but again, it's a feeling of something that they have to do in order to deal with the emotional distress that they're in. That shame can lead to intense negative feelings that may cause the person to continue to hurt themselves, and therefore creating this cycle of harming. People with non-suicidal self-injury do not intend to complete suicide. However, they may cause more harm than intended, which could result in medical complications or even death. The behavior can, again, become a dangerous cycle and a long-term habit if students aren't taught ways to cope with the emotional distress that they're in. So what can you do as a parent? How do you help your child when you know that they're self-harming? So no parent is prepared to learn that their child is self-harming. Guilt, anger, and worry are common feelings for parents after self-harm has been discovered. But one of the first things that you can do is don't panic. You don't want to panic about this situation or cause your student to panic. You want to make sure that they're in a safe place so that they can listen and so that you can hear what they're trying to express in order to get the help that they need. You want to next address any immediate safety and medical concerns. So if there are any open wounds or other injuries, it's important to tend to them and seek out professional help. Next, you want to give yourself a moment to breathe. And parents, it's okay to give that to yourself. You don't have to have all of the answers. Nobody has written a handbook on parenting that works for every single kid. So it definitely takes a village for all of us, and to utilize your resources, your school counselors, your doctors, your physicians to help when these types of problems arise. Don't punish your child for self-harming. Many parents are inclined to try to punish to keep them away from this behavior in an attempt to try to provide them the motivation to stop self-harming. But punishments can also result in more self-harming. So now, instead of telling you about it and trying to get you to help understand why they're doing it, now they're going to continue and possibly hide it from you. So punishment isn't necessarily the answer. So ask questions to understand the behavior. A lot of times it is really difficult to try to talk to an adolescent. It is. And you can honestly take it personally, like they don't want to talk to me. Why does not my kid not want to talk to me? But that very well may not be the case. Your student may just be frustrated that they're not able to express what they are actually feeling, and they need you to kind of question them through the process to try to get those answers from them. So stay patient with them. Provide empathy. Sit there with them in that moment and help them to know that you are there to help them, and also seek out help. So here are a couple of quick references, just some links that you can look at with you and your student. The Mighty's Guide to Understanding Self-Harm is more student-based. There's an 800 number that your students can contact, or you can as well, for more help. And there's also an app. It's called the Calm Harm app. That is free for students to kind of utilize some of those coping mechanisms to help them alleviate some of that emotional distress. And then the Cornell Research Program on Self-Injury is a guide for parents to help give you some more tips and strategies to help deal with your students who may be self-harming. All right, so our next topic is suicidal ideation. So it's kind of a continuation of self-harm in a sense. These are when your student may be having comments or thoughts about suicide, or looking for ways to kill themselves, or talk or write about death, dying, or suicide. So this is a pretty heavy topic. So there are two types of ideation. There's passive and there's also active. So passive ideation is your student is experiencing vague ideas about committing suicide. So student doesn't pass a test and they come home and say, oh, I should kill myself, right? Suicide is viewed as a possible way to end the pain that they're in, but usually no action is taken. They're not formulating a plan. They're not actually in the motion of considering it. Active ideation is when an adolescent experiences persistent thoughts of suicide and continues to feel hopelessness. When the ideation is active, a teen begins to take steps. So that means that they're now formulating a plan or initiating how they're going to put this suicide possibly into place. So although suicide ideation does not include physically harmful behaviors all of the time, over 1/3 of adolescents who experience suicidal ideation will attempt suicide within their lifetime. So it's a very serious topic when we talk about suicidal ideation. So here are some statistics about it. Youth suicidal ideation attempts and completions are on the rise, as we've seen with the other mental health issues we've talked about so far. So these results are from 2019, pre-pandemic, and they show that about 18.8% of high school students seriously considered attempting suicide, so having that suicidal ideation. And of that 18.8%, about 9% of them actually attempted. Suicide is now the second leading cause of death for adolescents and young adults in the age group of 15 to 24. And suicide attempts are significantly higher among youth compared to adults. Although suicidal ideation does not include physically harmful behaviors, again, remember that over 1/3 who experience it, the ideation may actually attempt. All right, so here are some risk factors. Some risk factors that your student may be at risk of suicidal ideation. Students with a history of substance abuse, if there have been previous suicide attempts, bullying, having a underlying mental health condition such as depression or grief, relationship problems, had losing a friend or a family member. All of these are risk factors for possible suicide ideation. Suicidal thoughts and depression often have many causes. So these social difficulties, these stressors, these academic pressures, and other concerns facing teens all can contribute to suicidal ideation. So here are some more specific signs. Remember, warning signs can be different for every individual teen or adolescent. And some teens keep these thoughts and feelings to themselves. So if you feel like your adolescent is showing any of these signs or not acting like themselves, be sure to ask. Open up the lines of communication. There's no harm in asking. If your teen or adolescent is becoming extremely agitated, is beginning to use alcohol or drugs, changing their personality or characteristics, being self-destructive, having those changes in sleep or eating patterns that could be more consistent with depression, having those extreme mood swings, frequently talking about death or dying in a sense that it's becoming more of a plan formulating in their head. If they're starting to give away possessions, giving away things to friends and family, if they're starting to say things to you like, I wish I were dead, or I need to talk to someone because I want to say goodbye to them. If they're looking for or trying to acquire weapons, this could also be a sign that they are considering suicidal ideation. So here's some information pre-pandemic. So about 19% of high school students, this was in 2019, pre-pandemic, about 19% were experiencing suicidal ideation. About 16% of the 19% actually made a plan. About 9% attempted suicide, and about 3% made a suicide attempt that had to be treated by a doctor. So this was pre-pandemic. So now let's look at the actual pandemic effects. So this was information, emergency room data during 2020. So at the beginning of the pandemic. And you can see that adolescent visits for suicidal ideation increased about 31%. In May of 2020, visits for suspected suicide attempts began to increase, specifically among adolescent girls between the ages of 12 to 17. And then from February 21st through March 20th of 2021, so kind of as we're in the middle of it, suspected suicide attempts were about 50.6 higher among girls than in 2019. And there was about a 4% increase in adolescent boys. So what can you do as a parent to help your student or your adolescent if they're having suicidal ideation? So first off, don't dismiss suicidal talk as teen drama. Kids aren't just going to bring up this topic for no reason. All right. So it's definitely something, if they're talking to you, if they're expressing it, it's definitely something that you want to hone in on and to question them about it. And it is a huge misconception that talking about suicide is going to put the idea into their head. That is not the case. So actually talking about suicide will help to keep the lines of communication open, especially if you think that they are at risk for suicidal ideation. So you want to listen. Even when your teen is not talking, you want to listen. Look at their body language. What are they telling you with that in itself? Directly ask about suicide. Are you suicidal? Is a question that you definitely can ask your adolescent student. Share your feelings. Tell them what you're feeling about the topic in general. Talk openly with them about them and let them know, again, that empathy is key and that you recognize the pain that they're in. And again, parents, you do not have to have all of the answers. Sometimes you have to just sit in it with them and just listen. Be supportive, understanding, and non-judgmental with the information that they're giving. They are living in a time and growing up in a time that is totally different from how we are. The things that we had to grow up being resilient about, our kids don't have to do anymore. And if they are, they're doing it in a totally different way. So it's definitely needed for you to listen and listen without judgment. If your student, again, is suicidal, possibly, then you definitely want to keep guns, weapons, prescriptions. You want to lock them away from your students so that they can remain safe. Watch for signs of substance abuse and get them the help that they need. Contact your school counselors, your pediatrician, or if you are in dire straits, take them straight to the emergency room for a risk assessment. So here are some additional protective factors to help your student or try to alleviate some of the stressors that they may be having. So helping them with problem solving skills, making sure that your students are interacting with positive peer relationships, their environment is safe, they have access to physical and mental health care, that they are being able to be resilient. We can't do everything for them. So we have to give our students, our children, opportunities to work through challenges. That's how they help build that resilience. And make sure that they have positive adult relationships. Talk to your student about, is there a teacher or somebody on campus that they feel that they can always go to if they need something? Who is at home, the person that they would go to if they have questions or experiencing thoughts or emotional distress? And here are some final quick links about suicidal ideation. Our National Suicide Prevention Line number is here. Rethink.org, youth suicide warning signs will just give you some more information to try to tap in on some more specifics that may be warning signs of suicidal ideation. There's a suicidal ideation myth buster that kind of gives you some information about possible misconceptions. And there's also the Substance Abuse and Mental Health Services Administration National Helpline if you suspect substance abuse as an issue for your adolescent.
Thank you, Ms. Wright. So lots of great information to know and things that you guys should definitely be considering as you're thinking about your child and your interactions with them. So thank you for hanging on and continuing to be with us. We are now to the last question for our panel. And that is going to be Ms. Heather Benbrook is going to help us out. So question number 5 is, my child is all over the place with her moods. She has angry outbursts one minute and wants to be cuddled the next. What could be going on?
All right, so I don't know if you can see my background or not, but we're trying to hone in our calm here. I know we've had some pretty heavy topics today, but we're going to really focus on emotional regulation. So in order to understand emotional regulation, we need to know what regulation looks like and what dysregulation looks like. And so a common depiction that you can use with kids, I use it with my pre-K kids here at the school, but this can be used with adults as well. So Dr. Dan Siegel, he came up with the hand-brain model. And basically what you do, you just put your hand up, put your thumb on the inside. This part of your brain, your arm kind of represents your your brainstem, sorry. And then the thumb and the inner part of your palm represents your emotional brain and your amygdala. And that's where our fight or flight, freeze, all the other ones that you can think of that go into that emotional response system. And then our fingers, if you fold them over your thumb, that is going to be what I like to call with my kids the thinking brain or your prefrontal cortex. And so this brain model is so powerful just to teach kids so that they know they can go like this. I'm not regulated. I'm in dysregulation. We call it flipping our lids. And so that's you have to understand your brain before you can really learn how to regulate yourself and work on that self-regulation. Also, part of that is your sympathetic nervous system and your parasympathetic nervous system. Basically, I like to tell my kids this. I think it makes sense for adults too. Like, this is just an easy way, layman's terms, to understand our brains and what's going on there. The sympathetic, I like to call it my caveman brain. And so that's this part of the brain, the inner part, where we're focused on our emotions, and we are not in our right mind. I call it caveman brain because we're in our fight or flight response. And I tell my students, if a saber-toothed tiger came through the door right now, what would you do? And then someone will be like, I'd fight it. And then the other ones would be like, I'd run away. And so that is our sympathetic nervous system in play right there. And then we have our parasympathetic system where we actually get control again, and we have self-control, and that's that closed lid, that unflipped brain. You can go to the next one. So they've already kind of touched on a lot of this, but I did find some statistics recently in just the visual alone, 2019 to 2020, 2021, and in the span of the past year or two. Anxiety rates have quadrupled in some sense. Depression rates have, it looks like, almost quadrupled as well, tripled or quadrupled. And so the pandemic has caused our status, it's almost like a hyper state of dysregulation. And so we've been constantly in this fight or flight mode. And so with COVID, with the pandemic, with natural disasters, all of those things, we are just in this constant state of change, and that's hard. That creates stress. And so we're in this constant flip lid state where, we may have experienced grief or loss or trauma. And so just a little fact about trauma is that you reach a peak of trauma about 18 months out from a period of trauma, or like an instant of trauma. So that's a moment of trauma. And so the healing process really starts to happen when you're at that 18-month mark and it starts to calm down. The problem with the pandemic is that we haven't reached that 18-month mark. We're still in it. And so it's almost like we've created a numbness when it comes to our dysregulation, or a new threshold when it comes to our emotional regulation, our self-regulation baseline, in a sense. And so that baseline has increased. And so now we're just, we call it the new normal. It doesn't feel normal because it's stressful. We're in a period of stress and trauma. But it's just kind of up that threshold. And we haven't been able to come down from that hill of trauma in that 18-month period yet. Even though it's been longer than 18 months, it just hasn't ended yet. And so that's where we're seeing the biggest jumps here. And that's where we're just almost like in a constant dysregulation. But also wanted to add a little tidbit of hope in here. Even though COVID has brought about a bunch of change, it's also brought about resiliency and opportunities for humans to connect in different ways and to find those meaningful connections. And so I don't want to say all the negative of COVID, because there is some positive to it too, where we have actually grown. And when we experience trauma and we experience all of this dysregulation, we learn new ways of coping. And so with that, we're going to learn a little bit more about that. So don't want to harp too much on the COVID statistics, but so when we're looking at emotional dysregulation, this is what it looks for. So, or what it looks like. There's the physical, the psychosomatic symptoms that we might experience. There's the emotional side of it, and then there's the social side of it as well. Because we're human, right? We need to look at the big picture and the whole picture of how we work and how that regulation can affect our different areas in life. And so physical symptoms that you might want to look like mood changes, new aches, new pains, headaches, stomach aches, racing heart, insomnia, the list goes on. Just those major changes in your body, what you can actually feel physically in your body. And then we go into the emotional or the psychological. This is, and the ladies have really done a great job at explaining the suicide, the anxiety, all of those things. But when you're dysregulated, you're going to start seeing some of these heightened emotions. And they said it too. It's big changes that you see in our emotions, regressive behaviors, especially in children. These are all things from trauma. And so we everybody experiences trauma in different ways, like she said earlier, whether it's you're living through it or it's a perceived trauma. And so trauma is trauma, and we are all dealing with it in our own ways. So those are the emotional sides of it as well. Then there's the social, that withdrawal, maybe avoiding school, not wanting to go to school, or not wanting to go to parties and different things like that. I feel like, especially if you're an introverted person, COVID might have been great for a little bit, but we're also human and we need those connections. And so sometimes it might be a little difficult coming back into those social settings, and just increased conflict. And just sometimes just attention-seeking behaviors as well. So that dysregulation can look very different for different people, but you will definitely be able to see that it's a change in that person overall. And so how can we help? Okay, so I am big into play therapy, and Gary Landreth, he is a huge proponent, a theorist in the play therapy world. And he has a saying that says, I am here for you. I hear you. I understand you. I care. And so from that, I just came up with this thing, just be. What can we do? Just be. Be with them. Be in the moment. Be reflective. Be a model. Because when we're with them, like you said earlier, the eye contact and things like that, they're feeling that you're there for them, and that's what they need. Humans need that, not just kids. Being in the moment, being mindful. When we focus on the moment, we're not thinking of the past, we're not thinking of the future, we're just being in that moment. Being reflective, saying, oh, I see that you're feeling angry. I see that you are feeling sad. Reflect that emotion, reflect what they are saying, and in the way that we are with them. And then just be a model. We're human. Adults are human too. If we can't regulate ourselves, it's very hard to teach the kids that. So if we can try to model that ourselves and let them know, we're human too. We have feelings too. And it's okay. It's okay. And we're here for each other. And so just being there and being a model. There's an article in here too, whenever you get it, the do's and do nots of de-escalation with children. It's a really good resource. It's an article that I had found that you can kind of look at of some of the, the what you should and should not do kind of thing. And then ultimately, I know this is cliche, but I always have to go back to it. You have to put your mask on first in order to help them. And so we can't help others unless we help ourselves first. And so take time for yourself. take care of yourself, make time for yourself and self-care as well, so that we can help our kids with their emotional regulation. So there's some other strategies that I just wanted to share out. I just had a list in there, and then I found some resources that you can use and click on as well. So mindfulness strategies, about just being in the moment, just being present. There's so many resources out there on mindfulness right now. It's definitely a hot topic. And so just finding that moment, it doesn't have to be big. It can be 2 minutes. You just go outside real quick. You go look and find 5 things you see. It doesn't have to be anything major. You're not doing meditation. It's just mindfulness. You're just in the moment, and that's all it really is. Positive thought reframing. Y'all kind of touched on it earlier too. Just I always try to tell my students and my clients as well, you don't have to change a negative to a positive, because sometimes that's not realistic and it's very difficult. So changing your thoughts into a realistic thought, or even if you can take it a step further to a positive thought, taking that negative to a positive and just reframing the way we say things and the way we think about things. Thought distraction. There's so many tools. We're not trying to bury the thought. We're trying to just distract ourselves in that moment where we have a flipped lid and where we need to get back in control. So just distracting your mind and focusing on your thoughts versus those feelings that you're feeling, those intense feelings. Looking up. Many of us had a training recently called Emotional Poverty with Ruby Payne. And this strategy, ever since we found out about it, I have been using it and using it and using it, not only in my personal life, but with my students, with my clients. And it is so powerful. And it is so simple. It is literally looking up. So you just, actually, Amber, can you click on the looking up one right there? I created a little tool, a little reference sheet. It's just a little informative little page that I put together real quick. So something that I give my clients and my students is this sheet, and I just say, okay, looking up. So the physical movement of your eyeballs in your eye socket will depend on what part of your brain you're using. And so I just tell my kids, look up and find things that you see. It will help you be as calm as you can be. And so when your eyes are down, we're in that caveman brain. We're in our emotional thoughts. When our eyes are straight, he's jamming out there. We're actually active listening, and we're using the auditory parts of our brain. But when you look up, you're actually getting that thinking brain engaged, and you're using that prefrontal cortex. And so that's a little reference sheet. If you feel free, you have access to it. You can print it out, put it in your kid's bedroom, put it on your refrigerator, do what you want with that. But it is so powerful, and you're grounding yourself in that moment, which brings me to grounding. Not what you think. We're not grounding our kids. We're grounding ourselves and helping our kids ground themselves as well. It's not the 2-week punishment in their bedroom, but you're using your 5 senses. And so you connect your senses to the moment that you're in. And so you do, there's different variations, but 5 things you see, which is why I did the looking up, and 5 things as well to connect that. You can also lead that into a grounding exercise. So 4 things that you feel, 3 things that you hear, 2 things that you smell, and 1 thing that you taste. And so you can bring yourself down and do that 5, 4, 3, 2, 1. And when we verbalize it, it makes those brain connections as well, where we're in our prefrontal cortex. And then just play. I know that play sounds like very childish, but I don't care if you're 100 years old. We all just want to play sometimes. Get a sand tray out. There's an app in there, not an app, but a link in there with an online sand tray, and it is so powerful just to put our thoughts in there. And who doesn't like to play, right? And some other things that I put in there, Calm. I know that's been mentioned before. There's tons of calming apps out there. Calm is one of the most popular ones. Some grounding techniques. There's a therapist aid. There is a little resource that you can do there. Mineola Grows. This is actually really cool that I found. Just recently found this, but it's a self-regulation series on YouTube for kids. But you can use it, and it helps adults too. I think it's like a 5 or 6 part series where they just have fun little videos that kids can really engage into. Kids, junior high kiddos, adolescents, adults. It doesn't matter what the age is. And then Cosmic Kids is one that we like a lot too. It's yoga and guided relaxation, different videos on YouTube. They actually have a YouTube channel and they have a website as well that you can just be in the moment, and it's guided, and it helps you work through those emotions when we're dysregulated. And so there's tons of resources that I found out there. Some of them were mentioned in there and some of them weren't, but yeah, it's great stuff out there. There's tons of information, tons of tips and techniques that you can use that as counselors might use, but also that can be used in everyday life. So hopefully that was beneficial for you.
Thank you, Ms. Benbrook. It definitely was great information and great visuals. So I want to thank you, all my parent and family troopers, for hanging out and listening to this information. It was a lot of information and some very, very big topics. So what I do want to recommend is that if you have further questions, if you have specific questions, reach out to your school counselor. These are things that they are trained in, and if they don't know the answer, they're going to find the answer for you, or they're going to find some information and resources to help you out. So we want to make sure that that you have this PowerPoint and this recording, all of this information will be emailed to you. Here's some just additional resources on top of what was already included in everybody's slide. So again, thank you so much for listening in, and we hope to see you again soon in some more workshops. Appreciate you.